My name is Dr. Kelechukwu Clement Onwoha. I'm a lecturer and a consultant orthopedic surgeon here at Babcock University Teaching Hospital. My jobs here include carrying out surgeries, leading surgeries, training resident doctors, taking part in outpatient clinics, and conducting tutorials for students. We carry out a wide range of surgeries here, which include from major to intermediate and minor surgeries. Our major surgeries range from hip replacements, knee replacements, spine surgeries, fracture fixations, and much more.
Good morning.
Why did you come today?
I had a vascular necrosis of the left femoral head, and I was told I was going to be needing a surgery to correct that.
So what did it do for you?
To perform a total hip replacement surgery on the left leg.
Are you satisfied with what you've done?
Yeah, very well. I'm even walking already, and I'm happy.
Other procedures we do here include carrying out injections to the knee, to the spine, and also casting. We also do manipulation of deformities and correcting deformities of various kinds. Our staff are a whole wide range. Our anesthetist is a committed consultant anesthetist who helps in doing regional anesthesia for patients during surgeries.
I am Dr. Umtari Salami, a consultant in the Department of Anesthesia and Intensive Care. Specifically talking about the orthopedics and trauma care in Babcock University Teaching Hospital. The units of anesthesia that we use in our patients has proved very, very effective. We have regional anesthetic and general anesthesia that we perform. But most of our patients, except they are going for a spinal surgery, most of our patients going for spine surgery, in what I call is usually regional technique.
So now the days where patients have to sleep for all major surgeries, we can just anesthetize a particular area and the patient is awake, and we discuss during surgeries.
We have effective monitoring devices, including second by second blood pressure assessment, blood pressure measurement, and we also have pain measurement devices that we utilize during anesthesia. So basically, our patients are usually admitted right inside the trauma complex. We have the high dependency units. We also have the post-operative care room that the patient stays at least 24 to 48 hours, depending on their condition.
Also have resident doctors who scrub into cases and help in the surgeries we do.
My name is Dr. Olabife Johnson.
My name is Dr. Chukwuemehara.
My name is Dr. Oladiwuwanshinwadewumi, a resident doctor in Orthopedic Unit, Babcock University Teaching Hospital.
The orthopedic unit is at the forefront of management of patients with various degrees of orthopedic conditions or pathologies. Over the last 2 years, we've carried out successful procedures such as 30 spine surgeries, over 28 hip replacement surgeries, and also carried out about 30 knee replacement surgeries.
In the last 2 years, we've come a long way, and some of the ways we've done and achieved some feats is with the aid of a device known as the CIAM. It's an intraoperative fluoroscopy device used in reducing and retaining fractures with great precision. Also, in the last 2 years, we've also been able to conduct and carry out various surgeries, which includes, but not limited to, spine surgeries, scoliosis, lateral fixation, and so much more.
All these have been made possible due to the multidisciplinary approach in the management of patients with various degrees of orthopedic pathologies. Here at Babcock University Teaching Hospital, our patient care is tailored as giving them the very best and also reducing the ongoing medical tourism, which in its own self has affected or put so much pressure on our local currency.
I must say that this unit is one of the liveliest, one of the most industrious I've been. We offer very professional services. We have treated people that came all the way from abroad. I myself have also been a patient of the unit, and my surgery was excellent. Back to my feet, walking normally, no complications. These are more part of the reasons why I would recommend the orthopedic unit here for anyone who has any form of spine problem, orthopedic problem.
Can I assure you that your stay in Babcock will be a wonderful and interesting experience?
What procedure did you do in Babcock? Do you remember the procedure that was offered?
I think we did a surgery on tibia, the right leg.
So what happened to you?
Then, I was playing football, we were having a friendly match, and I got entangled with the goalkeeper. And I just heard a sound. My surgeon said, I think it's a pop sound then, if I can recollect. I came for the x-ray. After the x-ray, we did a POP, yeah. After the POP, we did the surgery.
What do you think about your outcome?
The outcome is good.
We have surgeons who we invite to help us in very difficult cases, both within and outside the country. They fly in to help us and assist us. We have dedicated nurses who are fast in all parts of orthopedic care, which include spine cases, fracture cases, hip replacements, and the like. And they're always on ground to help us whenever we need them.
As anyone from your life, my name, the chief nursing officer in charge of wound theaters. Under my care, I have 4 operating suites with the orthopedic unit inclusive. We had opportunity to perform several major cases like spine surgery, hip and knee replacement, arthroscopy, Adesegun procedure, and many others. By the grace of God, all the procedures mentioned have been successful, and this wouldn't have been possible if not for the God-fearing, qualified, competent, committed, and confident nurses, doctors, and other workers.
My name is Abiodun. I'm a pediatric nurse.
My name is Oyeko Oluwatosin.
Hi, my name is Educ Precious. In Babcock University Teaching Hospital Orthopedic Theatre, we do a lot of cases ranging from trauma, general orthopedic surgeries.
We have 3 phases of our program: pre-operative phase, intraoperative phase, and post-operative phase.
So what I do at the operative phase is familiarizing myself with the patient that is coming in for surgery. I perform my head-to-toe assessment, inform the patient some of the expectations in the operating room.
During our pre-operative phase, we try as much as possible to stabilize our patients. We ask questions and at the same time, we clear doubts, means the patient will come and with misconceptions. So we try as much as possible to clear that doubts and make them stable to have a good outcome.
After the pre-op visits with the patients, I go back to the operating room to ensure adequate preparation for the patient and the procedure itself. I ensure the instruments needed for the surgery are available and they have been sterilized. Intraoperatively, patient safety is of high importance to us as nurses as well as other team members. We ensure that the patient's needs are adequately met even while under anesthesia. Postoperatively, we nurse the patient in recovery room prior transfer back to the ward. We check the vital signs regularly until the patient is fully stable from effects of anesthesia. We also observe the operation site for bleeding. We ensure adequate pain management. We provide the patient with adequate warmth and make sure the patient is comfortable.
We have a qualified prosthetic and orthosis who helps us with our cast and manipulations and also the official links for patients who have had amputations in the past.
My name is Goodness Sajero. I am a prosthetist and orthotist. I work here in Babcock University Teaching Hospital. We feed patients with different kinds of braces and supports. Patients that need mobility aids, assistive devices, all forms of orthosis. We try as much as possible to make that readily available. I also prescribe and recommend the preferred prosthetics for patients who must have undergone amputation, especially the lower limb prosthetics, that's transfemoral or transtibial prosthesis for the patients. Okay, so here we have a full display of the braces and supports, the utilities, the mobility aids that we use in the orthopedic unit for patients. It ranges from the items that patients need according to the cases that we see often. For example, the commode, this is the commode chair. We use it for patients that had hip replacement so that they would not sit exactly at 90 degrees or squat so low. The Iowa brace for management of clubfoot in children. Have the walking sticks, tailor's brace, the braces and supports, and the air cast foot. Almost all forms of devices, and we can also produce shoes. Most of the times you can come across indigent patients who may not be able to afford this kind of clubfoot shoe. The university at the moment is making plans to set up a prosthetic center so that everything about artificial legs, artificial hands would be produced here in Babcock University. We are very much optimistic because it is well underway and it's going to be done. Thank you for coming to the orthotics and prosthetics aspect of our unit.
Our physiotherapist is committed and it helps us rehabilitating our patients such that after surgery for example lower limb, patient gets up the next day and starts walking thanks to our wonderful physiotherapist.
My name is Fadi Ibiolaksoboso. I'm a physiotherapist in Babcock University Teaching Hospital. The Orthopedic team is one of the units we work together with often. We've been managing together, and by God's grace, we've been having good results. Basically, we manage their surgical patients, majorly cervical decompression, lumbar decompression and fusion, back pain patients, on-house patients, low back pain patients, osteoarthritis patients, and amongst others. During the pre-op, part of our responsibility is to give patients education and then carry out some exercises that will improve their functional mobility after the surgery. Then after the surgery, we see them on bed, starting with exercises on bed, strengthening exercises, strong stability exercises to get them out of bed and ambulate them to the highest level of independence. And by God's grace, we are getting good results. Our patients are happy with our management and services here, and we are happy that we're able to deliver quality service to our patients.
Initially, when I came here, I cannot walk. I went for this scan test, MIR test. They discovered that my neck here, about 7 of it, 7 is here, but out of that 7, it is only 3 that is functioning. Dr. Noah now said I have to be operated upon. I came for the surgery. The surgery was a successful one. It was just at the back here. Eventually today, I am a new man.
We have medical students who are always on ground, assisting in surgeries, taking part in lectures, and learning actively about orthopedic care in Nigeria and the sub-region. For the equipment, we have a whole wide range, ranging from the accident and emergency, where we resuscitate patients who have fractures. We have a mobile X-ray machine. With it, we can take X-rays of patients on the spot as they arrive. And when we make a diagnosis, we can wheel them in for surgeries as at when due. We also have other equipment in the accident and emergency for resuscitation of patients who come in with different kinds of injuries at the accident and emergency unit. We also have a fracture table that helps us reduce fractures adequately during our fracture fixations. All these are just a few of the wide range of things we have in the Orthopedic unit of Babcock University Teaching Hospital. Concerning our accommodation, we have a very comfortable environment for our patients, and they feel at home. We feed in and other things that make them very comfortable while on admission.
So are you very happy with the services rendered here at Babcock?
Yeah, very happy.
So what do you tell other people?
If they have this kind of an injury, I can refer them to Babcock University Teaching Hospital to come to their own surgery here too.
That's good news.
And I would want to say a big thank you to Dr. Onwa and the whole of the orthopedic team. God bless you all. I appreciate you. Thank you so much.
So far, our Babcock University Hospital has become a one-stop shop for all patients, such that when you come into this place, you don't have to go far or go abroad for orthopedic care again. I thank the Almighty God for His enablement and for helping us to reach this far in orthopedic care in Babcock University Teaching Hospital. I also want to thank the management of the university and the management of the teaching hospital for giving us what we've needed so far in terms of equipment and the support taking care of our patients. Our aim is to reverse medical tourism as far as orthopedic care is concerned and to become a one-stop shop for all our patients. Once again, welcome to Babcock University Hospital. You're welcome to our world always. Cheers.